I am Dr. Mary Giorgieri. I'm a holistic health professional, and welcome to Holistic Health Now. I'm very excited because we are launching a new series for you called Staying Well. What we are planning on doing and what I'd like to do with you is to give you healthy tidbits, to provide you with research, information, awareness, and anything that we can give you on certain specific topics that will allow you to have this knowledge so that you can integrate it into your life so that you can stay well. I think this is so important now because one main thing, we are in crisis in our health care. Medicine is having all types of difficulties, and I have some research here for you that because our healthcare system is in chaos, people are not getting well. The pharmaceuticals are completely out of control, and the abuse of drugs are causing major health conditions. Now, there is a report and a study called Death by Medicine. What is so difficult about this is to understand that this research, and it's very detailed research, shows that our medical system is one of the leading causes of death and permanent injuries in the United States today. One of the main parts of this is infections. And your chances of getting an infection when you go into a hospital are 33%. So with this new series of Staying Well, we want to bring you information that can help you stay out of the hospital and try looking at the non-invasive therapies first, the therapies that are going to give you more naturopathic things that don't have any side effects. There's nothing wrong, absolutely nothing wrong if you need to have a medication or you have an asthma attack. We're not saying that. What we're saying is that to stay well, and this is my key, to stay well, we've got to move to a wellness paradigm in healthcare instead of a disease paradigm. So let's launch our first one with a topic called winter blues. What do we have in the wintertime? Infections, we have flus, we have colds, we have congestions, sinus irritations, lung issues, and all of it is surrounded about and around the fact that we are in a culture that is busy, where we don't stay home and take care of ourselves if we have a cold and stay home for 2 or 3 days and drink liquids and relax and so on. So basically what I'd like to share with you today is some materials that you can use to stay well during the winter blues season, and things that you can use and try at least first that are more naturopathic. You know, it's easy to take these Sinutab sprays, but oftentimes it dries you up, it makes you feel good for a little bit, but then what happens is it becomes back with a vengeance, more mucus. Also, when you do all types of Advils and certain types of medications like that, they really may help with that pain, and that may be necessary, I understand that, but we have side effects. There's not a pharmaceutical out there that doesn't have some kind of a side effect. So this is what we're trying to do, is to see how many tools that we can share with you today, just for the topic of staying well with the concept of winter blues upon us, that you can use and at least try. The first thing I want to do is to talk to you, and the first thing I think that is primo is check your cabinet. Do you have vitamin D3 in there? It's called the sunshine vitamin. It is amazing, absolutely amazing, people who even take vitamin D and who are in maybe more of the winter cultures where we have snow and ice and colds and freezing rain and all types of things. Maybe what happens is that you see that you are, coming down with congestion or whatever, but what I have seen is even healthy people who are doing more naturopathic things, when we test and do blood tests for vitamin D3, it's very low. We have an epidemic of vitamin D deficiency. Now, I like to recommend that if you take vitamin D3, that you're looking at least 2,000 to 3,000 mgs. Now, people go, whoa, that's a lot. Not really when you look at the need for it. There's such heavy research on vitamin D3 and the prevention of colon cancer. Not only colon cancer, but the idea that it prevents almost 12 to 13%. If you take even 1,000 of vitamin Ds, it prevents a lot of the colon cancer polyps and things like that start with that problem. So vitamin D3, but I also like to recommend that you do it with a magnesium and a calcium. supplement together. Now this one happens to be D3, and it has magnesium, 500 mg's of magnesium, and it has calcium. There's sufficient amount of calcium, about 1,000 mg's of calcium. Those three together work synergistically. The other thing that I think is really, really valuable for you is to think green. Green is a very high level of balancing in the body. It pulls mucus out of the body, it sustains alkalinity in the body, and I just tell people to get a bottle of liquid chlorophyll, put it in the refrigerator, take a couple tablespoons of liquid chlorophyll, put it in the water, and drink it down. Now, when we talk about these things like your vitamin D, your chlorophyll, taking greens, it also has an autoimmune effect, meaning it will boost your immunity. And when you're dealing with the winter blues, this is a very, very important thing. If you don't like to drink it or to take it with you, chlorella tablets, something green every day. Yes, would it be good to juice your greens? Sure. I think celery and cucumber juice, along with adding maybe some spinach or kale with it, is wonderful. But if you don't have time, then maybe mid-morning and mid-afternoon, take 2 or 3 tablets of chlorella. Again, the whole idea of green is that it is a neutralizing effect to your body, and it helps boost immunity, and it also helps, if you do have any mucus coming, it starts to remove the mucus from you. One of the tools that I think for winter blues is called the neti pot. This has reached all kinds of fame in the past years because people are starting to use it consistently for prevention of sinuses, sinus irritations, mucus. And I'll tell you, it is one of the best things once you learn to use it and use it right. Now, it's centuries old. They were using this in India long in the old Ayurvedic system of medicine. They were using the neti pots for constant cleansing of the nasal passages. You fill it up with good, clean water. I add either a little bit of colloidal silver. Colloidal silver is a natural antibiotic. I'm going to probably have one of our series of Staying Well I devote to all about colloidal silver. I add a little bit of colloidal silver to the neti pot, some good, lukewarm, not hot, not cold water, and all you do is you turn your head and you drain it right out. If you're stopped up anyhow, you might start draining a little bit, then blow your nose and then drain. Unbelievable, because sinus infections are rampant in winter. Part of it is that airborne, you cough, a cough or a sneeze, you can be 50 feet within somebody, and if they sneeze, you're going to get the particles, the mucus particles of the infections that they sneeze out. So this constantly keeps you flushed and irrigated. But what happens is that they treat sinus infections with antibiotics, and they don't work. Not that I'm opposed to antibiotics if you need it, but they don't work for the sinus infections because they're more viral. But if you catch it ahead, and if you like to breathe, this is a constant. Sometimes I'll do this 2 or 3 times a day if I'm in that winter blues and I have some stuffiness. The other variable that I think is really, really good as far as preventing this, and these are things that you do right along with your getting up in the morning, and maybe just take a few things, just kind of organize it. It's called tongue scraping. This is actual, you can get this in most health food stores. It's a tongue scraper. And basically, I always tell you, put some water in your mouth, rinse it out. Your tongue collects toxins. You sleep because you need to detox. So your tongue collects the toxins. So after you have rinsed out your mouth, I always tongue scrape before I brush my teeth. I brush my teeth and tongue scrape a little bit afterwards. And it removes all those heavy, heavy toxins so you don't reabsorb them. The other thing is skin brushing. One of the keys to your health and complete health when you are talking about staying well is to boost your immune system. That's your core to your health and wellness. You do this absolutely dry. I keep one right in my bathroom. I put one in my travel case. And you brush everything from your body, your limbs to your heart, your neck to your heart, and then your limbs, your feet, your legs and everything to your stomach. Down your back. And all you do is you don't have to do it a lot, just one brush. Stimulates the autoimmune system to about 28% more capacity for immunity. An excellent habit to get into. It's the same thing like the skin brushing. Now, the other variable which I'm going to talk more about, and we're going to, part of our series of Staying Well is to introduce you to herbals, to introduce you to homeopathics. So the one thing that we feel strongly about is to look for, especially the winter blues, look at the herbs. You know, some of these herbs are so accurate and so non-invasive, and they work so well. Most of the time you'll hear one of the most researched herbs for winter blues is echinacea. Now, echinacea is good if you use golden seal with it. We have a formula called Healthy Cell, and it's a combination of astragalus, reishi, ashwagandha, garlic, cayenne pepper, echinacea, ginseng, schisandra. These synergy herbs, especially when you use them as a tincture, are just brilliant in the system because they absolutely autoimmune enhance, and they also work on infections. They also work on really if you have any bacteria. So always think about it. You know, staying well means prevention. Staying well means that you do things before you end up in conditions that really need catastrophic care, and that's what medicine is about. So I think if you don't know enough about it, hopefully we're going to give you information that will help you. One of your big ones is garlic. Now, maybe with the winter blues, if you eat enough garlic, people will stay away from you and therefore won't give you colds. So that's a good idea. So what I'd like to do in this series of Staying Well is to empower you, to help you have the awareness and the knowledge of looking at yourself and saying, you know what, medicine is changing, healthcare is changing, and don't kid yourself. When we see what's happening with the changes in healthcare, it needs to change. And what is happening is that corporations, and because of the economy, people are not getting the health benefits they need, so they're going to be having decisions to make. If I have discretionary funds for healthcare and I'm not getting as much in my insurance, have you looked at your co-pays lately? Have you gone to the doctors to have an x-ray or something and look how much we have to pay now? This is all changing, and it's in a big bubble. But what's also in the big bubble is the holistic, the prevention, and we now have very, very good schools that are training academically our holistic health practitioners. We're seeing West meet East. So in our series of Staying Well, we hope that you'll absolutely gain the information, the knowledge that you need to help yourself use the skills and the information to keep yourself well. So I'd like to thank you and tune in again. So thank you and stay well.